Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I'm pleased to welcome you to the multimedia summary for the journal's December 2019 issue. There are 3 articles that have been selected as our editor's choice or highlights articles this month. Our editor's choice is an original article entitled Prescription Opioid Epidemic and Trends in the Clinical Development of New Pain Medications. This article is authored by Mr. Thomas Wang and colleagues from Brigham and Women's Hospital and Harvard Medical School, both in Boston, Massachusetts. The current opioid crisis underscores the need for pain medications that do not carry the risk of dependency and addiction and are not constrained by a narrow therapeutic index, all such properties being strikingly exhibited by opioids. To assess the landscape of the development of such pain medications, Wang et al. Undertook a retrospective analysis of pain medications undergoing clinical trials between 2000 and 2015, a study published in the current issue of Mayo Clinic Proceedings. Drugs were broadly divided into 2 categories: new pain drugs, including drugs directed to novel biologic processes underlying their analgesic action and not approved by the U.S. Food and Drug Administration, and reformulated pain drugs, including abuse-deterrent opioid formulations representing derivatives of pain medications in current clinical use. The data demonstrate that there was a significant decrease in the proportion of new pain drugs as indexed against all new drugs beginning phase 1 clinical trials over a 3-year period at the start and at the end of the time frame of this study, whereas this proportion remained relatively stable for new pain drugs entering phase 2 or phase 3 clinical trials. There was a marked attrition in new pain drugs successfully progressing to phase 3 clinical trials, with only 11% of new drugs starting phase 2 clinical trials advancing to phase 3 clinical trials. New drugs failed to progress for the most part because of lack of demonstrable efficacy. In contrast, over the time frame of this study, the number of reformulated opioid and non-opioid pain drugs starting phase 1 trials increased, and by the end of the time frame of this study had outstripped new pain drugs beginning such studies. Based on these findings, Wang et al. Emphasize a number of points that include the following considerations. First, reformulated pain drugs are commonly abuse-deterrent opioids, but the long-term efficacy and cost of this latter therapeutic strategy is currently unclear. Second, new pain drug development is sponsored mainly by relatively smaller pharmaceutical companies, leading Wang et al. To suggest the need for the provision of incentives to such manufacturers by healthcare policymakers. Third, Wang et al. Strongly emphasized the need to significantly enhance funding for basic research into the biology of pain. This call is firmly founded on innumerable examples in clinical practice wherein drug development proceeded from an understanding of the relevant biology and pathobiology. It should be noted, however, that the discovery of compounds effective in preclinical studies and the translation of such discoveries into novel therapies is a long, costly, and winnowing process. Only a fraction of such compounds successfully traverse what is called the valley of death in drug development. Wang et al. Call attention to the fact that the development of novel pain medications is declining as compared with all new drug development, a sobering finding especially in the light of the current opioid crisis. Increasing basic research in the biology of pain and discovering new ways to interrupt the processes of pain would secure a pipeline of novel analgesic compounds, some of which hopefully would advance through the clinical trials and become therapeutic realities. Our first highlight article is an original article entitled Direct Oral Factor Xa Inhibitors for the Treatment of Acute Cancer-Associated Venous Thrombosis, a Systematic Review and Network Meta-Analysis. This article is authored by Dr. Harry Fuentes and colleagues from Mayo Clinic in Rochester, Minnesota, and the North Shore University Health System in Evanston, Illinois. The risk for venous thromboembolism is increased several-fold in patients with cancer, and such occurrence of venous thromboembolism increases morbidity and mortality in this patient population. This risk of venous thromboembolism is increased because of a prothrombotic milieu created by the presence of cancer, and variably so depending upon the type of cancer, the prothrombotic effects of certain chemotherapies and other cancer-targeted therapies, the need for hospitalization and surgical procedures, patient-dependent factors such as age, body mass index, and other coexisting illnesses, patient debility and decreased mobility, and the use of central venous catheters. Therapies that decrease the risk of venous thromboembolism in patients with cancer, however, may incur the risk of the opposite outcome, namely bleeding, and one to which the cancer patient is already predisposed. An increased risk of bleeding may arise from regional, systemic, and bone marrow effects of the underlying cancer, as well as the adverse effects of cancer-targeted procedures and therapies. The Scylla and Charybdis of thrombosis and bleeding may thus coexist in cancerous states. Direct oral anticoagulants represent a major therapeutic advance as they challenge the use of warfarin in certain clinical settings on such grounds as efficacy, safety profiles, relative ease of dosing, pharmacokinetic consistency, and the need for monitoring. Interest thus surrounds the use of direct oral anticoagulants in treating acute venous thromboembolism in patients with cancer. In the present issue of Mayo Clinic Proceedings, the systematic review and network meta-analysis of Fuentes et al. Examined the relative efficacy of direct oral anticoagulants in treating venous thromboembolism associated with cancer. Prior landmark studies established the superiority of low molecular weight heparin such as dalteparin over coumarins, warfarin, in cancer-associated venous thromboembolism. Until recently, low molecular weight heparins, including dalteparin, have been broadly recommended as the preferred treatment in preventing the reoccurrence of venous thromboembolism. Fuentes et al. Analyzed the results from 3 randomized controlled trials involving more than 1,700 patients, which assessed the efficacy and safety of direct oral anticoagulants as compared with dalteparin. In this analysis by Fuentes et al., the major treatment outcome was recurrent venous thromboembolism, while the safety outcomes involved major bleeding and clinically relevant non-major bleeding. The essential findings of the analysis of Fuentes et al. Are that direct oral anticoagulants reduce the risk of recurrence of venous thromboembolism as compared with dalteparin, while apixaban among the direct oral anticoagulants appearing most effective in such risk reduction. Direct oral anticoagulants as a class, however, increase the risk of major bleeding as compared with dalteparin, with a comparable occurrence in clinically relevant non-major bleeding in these two groups. As is commonly the case in clinical medicine, newer therapies bring clear benefits but with certain attendant trade-offs, and in this case, direct oral anticoagulants significantly reduce the risk of venous thromboembolism in patients with cancer, but with the trade-off of augmenting the risk of major bleeding. Our second highlight article is an original article entitled Effect of Metformin on Microvascular Endothelial Function in Polycystic Ovary Syndrome. This article is authored by Dr. Behnam Hedari and colleagues from Mayo Clinic, Rochester, Minnesota. In health, the entire endothelium is a sizable organ that approximates 1 kilogram in weight and provides a surface area approaching that covered by a football field. This metabolically active cellular surface lining blood vessels produces vasodilators such as nitric oxide and prostacyclin and other vasoactive species. It fundamentally regulates vascular tone and reactivity, is anti-thrombotic and anti-inflammatory. It senses and responds to signals in the circulation, and it vitally enables tissue perfusion. Endothelial integrity can be compromised by a plethora of insults, including hypertension, smoking, hyperglycemia, hyperlipidemia, hyperuricemia, uremia, sepsis, among others. And the ensuing endothelial dysfunction largely reflects decreased bioavailability of nitric oxide. Endothelial dysfunction is not only a hallmark of existing clinical vascular disease, but endothelial dysfunction may be a harbinger of vascular disease that will subsequently develop. Endothelial dysfunction is thus of both diagnostic and prognostic significance, and it's present in diseases not conventionally considered as cardiovascular in nature may be of special interest. In this regard, the study by Hederi et al. In the current issue of Mayo Clinic Proceedings provides novel insights regarding endothelial behavior in polycystic ovary syndrome and in response to metformin. Polycystic ovary syndrome, a relatively common endocrinopathy in women, is characterized by menstrual irregularity, hyperandrogenism, and cystic ovaries, but not by overt cardiovascular disease. Hederi et al. Assess endothelial function by a method based on flow-mediated dilation. This method involves transient limb ischemia induced by the application of cuff pressure above systolic blood pressure, which when released is accompanied by reactive hyperemia. The magnitude of the hyperemic response provides a measure of endothelial function. The device employed by Hederi et al. In this study evaluates such responses in the index finger, ones that represents microvascular as opposed to macrovascular endothelial responses. Hederi et al. Found that approximately 36% of patients with polycystic ovary syndrome in their study exhibited endothelial dysfunction. Interestingly, while metformin administered for 3 months did not exert an overall effect on endothelial function when all subjects were considered, metformin did improve endothelial function in those subjects with baseline endothelial dysfunction. These effects of metformin appeared independent of alterations in glucose metabolism, insulin resistance, levels of androgens, or lipid profiles. The findings of Hederi et al. Raise several salient considerations. First, subjects with endothelial dysfunction, as compared with those with normal endothelial function, exhibited comparable systemic blood pressure, fasting plasma glucose concentrations, and plasma levels of insulin and C-peptide. This raises the possibility that the mechanisms underlying endothelial dysfunction in polycystic ovary syndrome may be upstream of or relatively independent of these hemodynamic and metabolic processes in polycystic ovary syndrome, or may be driven by as yet to be defined pathobiologic processes in polycystic ovary syndrome. Second, the improvement in endothelial dysfunction by metformin was independent of its metabolic effects, leading to the plausible speculation by the authors that other effects of metformin, including its increasingly recognized anti-senescence effects, may be relevant. Finally, while obesity, insulin resistance, and sleep apnea occur more frequently in patients with polycystic ovary syndrome and are conditions that predispose to cardiovascular diseases, the true risk for cardiovascular diseases in polycystic ovary syndrome remains uncertain. Hederi et al. Suggests that evaluating endothelial behavior may aid in defining the relative risk for such complications and in identifying those who would most likely benefit from metformin therapy. You can access these highlights and editor's choice articles free of charge during the entire month of December. When you visit our updated Mayo Clinic Proceeding website at www.mayoclinicproceedings.org, you will find links to our social media by clicking the buttons on the top of the home page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings fireside chat recordings, which are available from our website on the home page as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who've made a strong impact in their field of study. You will see many news stories on our website that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content and articles published online ahead of print. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.